I'm Dr. Mark Malone. I'm an anesthesiologist turned pain doctor about 20 years ago. I went to UT undergraduate here in Austin, and then I went to Southwestern Medical School in Dallas, and then completed my training at Baylor College of Medicine in Houston. I was inspired to establish advanced pain care about 20 years ago when I was working as a hospital anesthesiologist. We were doing a lot of orthopedic cases and a lot of spinal cases, and I realized that these patients were in chronic pain and depending on surgery to try to treat that pain. Sometimes that was fairly successful, but often it was not successful. And these patients would be suffering in between surgeries. I'd see some of the same patients come back for multiple repeat surgeries, suffering, losing weight, and just praying that the next surgery would help them. A great example of what we do and how we treat patients, I'll give you a typical patient. I had a 35-year-old female referred to me by a neurosurgeon after she'd had surgery. She'd been in chronic pain for about 4 years following a car wreck. She injured her back. She went first to her primary care doctor, who referred her to a spine surgeon. The spine surgeon did an MRI, didn't find enough damage to warrant surgery, so sent that patient to a neurologist. The neurologist did some further studies, some EMG, some electrical studies, and then referred the patient to a pain doctor, not myself, but another one. This other doctor did some spinal injections, including some epidural steroid injections that did not help. The patient then went to see a chiropractor and then saw another neurologist. Finally, the patient was sent back to a different neurosurgeon who performed spinal surgery. This didn't help the patient either. Finally, that neurosurgeon sent the patient to me. I did a thorough workup, had the patient see our own in-house neurosurgeon, and we together determined that the best course would be a spinal stimulator. She was implanted with a spinal stimulator by one of our pain doctors, and she's been pain-free ever since. That's a typical case, and we see it every day. These patients often suffer for years and are bounced from specialist to specialist. They're on a plethora of medication, get treatments, physical therapy, chiropractic care, and even surgery with no lasting relief. So finally, a multidisciplinary clinic got involved, and we found the definitive treatment. Everybody talks about multidisciplinary care in pain management. We take it to an extreme. We really practice multidisciplinary pain management. We have our own neurosurgeons, we have our own physical therapists, we have our own social workers who provide counseling, we have our own addictionology doctors, and our own rheumatology doctors. So we have all these specialists working within one big house to comprehensively diagnose and treat even the most complex pain problem. When I'm not working, I like to unwind by taking the boat out on the lake with my beautiful wife, my 5 kids, and my 4 dogs. Pain is inevitable, suffering is optional. Advanced pain care, the pain stops here.